And we're live. Hello, it's Bill, the knee pain guru, dealing with a little bit of poison ivy right here. So apparently I've had too much exposure in my life, so I get it pretty easily anymore. Okay, today we are going to talk about repairing meniscus without surgery. And that may be not the totally accurate title for it, but I'll read the question that came in yesterday, and we'll go from there. So this came in from Sean. He wrote directly through the Knee Pain Guru website, and it said, "Hey Bill, little history. Had a bad knee injury at age 20, with major repair to medial, lateral, and dislocated patella. Everything went well with surgery and no issues until this year, age 55, and whoa, the darn thing is unraveling. The knee itself looks good, still good space on the bone, but they have noticed some tearing of the meniscus, and this is causing inflammation and pain. I'm a golf professional and hit balls every day to demonstrate to my students, and this is becoming a chore. Went to the doctor to get a cortisone shot yesterday and see immediate change. Not 100%, but way less inflammation, and I can also straighten it. I can do 90% of exercises. Some are diagonal swings of the leg to demonstrate a little popping and grinding on the inner portion of the knee while doing squats. There are 2 places of pain to get through, but I get there. Anything on repairing meniscus without surgery? Thank you, Sean." Okay. So Sean is looking to address what's going on in the meniscus without surgery. And I did do a little research this morning because there's a study by and this will be in the notes down below in the description. I am including the links to this study. It's on pubmed.gov. It is also on, hold on a second, pubmed.gov and the New England Journal of Medicine.org website. So that'll all be in the description below. But basically, it's talking about arthroscopic partial meniscectomy being one of the most common orthopedic procedures, yet rigorous evidence of its efficacy is lacking. And the conclusion that came with the study was, in this trial involving patients without knee arthritis, but with symptoms of a degenerative medial meniscus tear, the outcomes after arthroscopic partial meniscectomy were no better than those of after a sham surgical procedure. So it's worth looking at and understanding when making a choice about whether to go for surgery or not, that depending on the type of meniscus tear, the location of the meniscus tear, you may not notice a difference in the pain that's going on in your knee. So that's what the medical perspective is as far as surgery. However, what Sean is asking is a specific pattern. Notice I say pattern. It's a wear pattern that's going on in his leg, in his knee, in his body that is causing the meniscus to tear. Well, this most likely has been there since his bad knee injury when he was 20. Now he's 55. 25 years later, the body has been dealing with this pattern, and now the body's recovery as we get older, it gets more challenging, more difficult. So we have this issue with the meniscus tearing. Being that the meniscus surgery may or may not lead to improvement in how the knee feels, we are left with dealing and addressing the underlying neurological pattern that is going on in the knee, in the leg, in the body. It's like a car that's been in an accident. It's a little crooked. And the more you drive it, the tires are going to wear in a certain pattern. this is important, when we take that analogy of the car and now we apply it to the knee, we have to understand that this pattern that is going on in the neurology of the knee is causing the wear, is causing the tearing in the meniscus, and is causing the pain and discomfort and grinding and all that. And by looking at how we can begin to address the neurological pattern, begin to change the neurological pattern, just like in the neurological pattern, let's take a step back. The neurological pattern is a pattern in the neurology, meaning the brain, the spinal column, and the nerves that go out to all parts of the body, including the knee. And it gives these parts of the body, the knee, the leg, the hips, the lower back, commands, certain commands. And based on the injury, or injuries, accidents, traumas, and surgeries, this neurological pattern gets adjusted in a way that is most likely causing the challenge that Sean is experiencing in his knee. And that is causing the grinding, that is causing the popping, that is causing the meniscus to tear and wear in a certain pattern. So we go to the neurology. If we just go to exercises, if we just go to stretching, we're not necessarily going to change the neurology of what's going on in the knee. And what I'm talking about as far as changing the neurology in the knee, we're hitting a reset in the neurology that causes the knee to begin to the body to begin to reorganize around the knee. What am I talking about? I'm talking about the intrinsic movement of the knee joint, the slight twisting, the slight forward and back, side to side, apart together, and tilting of the knee joint, which that intrinsic movement is significantly different than the gross motor movement of the knee, which is bending and extending. When we work with the intrinsic movement of the knee joint, beginning to reset that neurology causes the knee to create more space. This is comfortable. This is comfortable in the knee. We create a little bit more space, and what happens is we get the pressure off of the nerves that are causing the pain and the discomfort causing the friction, causing the joint to wear, the meniscus to tear. Like everything goes back into place as a result of changing the neurology and creating more space in the joint through comfort. Comfort is the key. Comfort allows the joint to relax. When the joint relaxes, it immediately has more space. Okay, if this is making sense, we have a few people online here. If this is making sense, please give the video a thumbs up, like and subscribe to the channel, turn on notifications for future videos. Feel free to share this video with your friends, family, and loved ones that are in pain, that are limping. If you have questions, please type those in the comments section. I will get those. We are live on both Facebook and YouTube this morning. Okay, so the essence of what I'm suggesting is, in terms of Sean's situation, is we need to take a step back before we go in and determine whether we need to go surgery or not surgery. We have to look at more information. We have to evaluate what's going on. We have to take in information in a way that allows us to see the end goal that you're looking for with your knee, and then step that back in a way to figure out, well, what more information do we need into the equation? What do we have available as resources for you? And what is the path out of pain? What is the path to get you the ideal outcome that you're looking for with your knee? So, first and foremost, create comfort. Second, set up the conditions in the knee as well as in the body so the body can heal the knee. So you can increase your mobility, flexibility, strength, all of that. And then third is avoid self-sabotage. Okay, let's see. We got a question here. Jimmy Lowe says, good day, Mr. Paravano. Had meniscus surgery 5 years ago. 3 years ago, my surgeon said need a knee replacement. Okay, Jimmy, do you want a knee replacement? Like, the everything that I'm talking about is the same. When we talk about patterns, it doesn't matter how long ago this was, how long you've been in pain, what your age. Like, a lot of that is actually as not as important as your mindset that you believe your body has the capacity to heal itself, that if you believe there's a way out of pain. And then all we need to do is begin to start creating that reality for your knee. Once you begin to get the pressure off of the nerves in the knee causing pain, you begin to get relief. Now, that relief may not last, especially Jimmy has a situation where meniscus surgery 5 years ago, which means his knee was in pain longer than 5 years ago. So the pain has been there for a while. And when we're in pain for an extended period of time, it changes how we think, it changes how we feel, because pain is a feeling. So now we begin to change the neurology of what's going on in the knee, and you get relief. And you're like, well, it came back though. Well, yeah, you've been in pain for longer than 5 years. We need to create a new reality for it. We need to support the direction your knee is moving, your body is moving to heal your knee. Jimmy continues. Let's see. Went to the doc, went last year, and the doc said meniscus is gone. However, I stopped corticosteroids, developed my own way with your videos. In short, I'm 65 and no problem, staying ready and maintaining. Happy now. Well, great. Awesome. That's good stuff. However, you have to question how happy you are if you're still going to the doctor and the doctor is going, you're going to need a knee replacement. Is it really working? And this is being honest with yourself. Either way is okay with me. The point is, if you're not doing what you want, if you're not living the life the way you want, well, then we need to course correct. We need to change direction. Okay, got some people on here. Questions are coming in. If you want to know more information, you can head on over to my website, thekneepainguru.com. We can also set up a time for consultation. I do consultations. These are one-offs, and these will it's essentially developing a strategy for you to get out of pain. This is not to get you out of pain. The consultations are not to get you out of pain, because especially if it's a situation where someone has been in pain for years, or in Sean's case, he's been dealing with knee stuff for decades. We need to go back, figure a strategy, and really work on a consistent and a regular basis to get you out of pain, to get increased flexibility and mobility in your knee. So the consultations are really to develop that strategy for you. And if you really want to work, if you're serious about it, I have a group coaching program, Knee Club. This week is a special. It's I'm waiving the enrollment fee, which is normally $197, and that is being waived. And then you get to try out the program for 7 days, and then it goes to a monthly recurring charge. You can go ahead and check that out on the Knee Club link. All of this is in the link in the description box below. I also included the links to the New England Journal of Medicine and the PubMed article, the study on meniscus surgeries. Okay, let's see. D. What does D write? I'd love to be pain-free after 45 Ops, yes, 45 plus, 3 reconstructions, bone grafts. Most of my cartilage is gone. I've done steroid injections, only short-term relief, like 3 months. I've been told need a knee replacement, but most of my issue is on the outside. But pain is actually an inside aspect. The kneecap is my issue. Any advice? Well, get the pressure off of the nerves in the knee that are causing the pain, which begins to give you immediate relief. And then let's see where that goes. That is the shortest distance between you being in pain, having discomfort, and being out of pain, is getting the pressure off of the nerves in the knee that are causing the pain. Nerves in the knee that are the width of an eyelash. And when we begin to do that, we begin to retrain your nervous system how not to be in pain. Because right now, if you've had that many surgeries, what ends up happening is the body learns how to be in pain. And that's what it knows. And that's what it's easy to default to. And we need to change the direction, start creating comfort, and then create the conditions so your body can continue in that direction. So it's going to be, doesn't matter how many, once again, doesn't matter how many surgeries you've had, what your diagnosis is, what your age is. The point of it is to create comfort, set up the conditions so your body can heal itself, and then begin to avoid those landmines and pitfalls that'll get you back into pain. And once we create that baseline for your knee, now we can move forward from there. Move forward from there in a way that allows your body to continue to heal. I'm only 39. Yeah, she'll work just fine for you. Okay, let's see. Jimmy says, no, not going to doc. I'm good. Lost 50 pounds. Changed gait and have minimized pain big time. Changed the way I do things. No meds, no surgery. Thanks to changing with your guidance, getting pressure off daily. Okay, Jimmy. Awesome. That's great stuff. Make sure to give the video a thumbs up. Like and subscribe to the channel. Turn on notifications for future videos. If you've got a question, please put those in the comments section. I'll be happy to address it. And what I've noticed is when people, like straight off the internet, they find me, they're like, okay, you got any advice? You got any tips? You got any suggestions? You got any recommendations? They all kind of fall into the same, it's like the same question. And all of it falls into the category of create comfort in the knee, set up the conditions so the body can heal what's going on in the knee, and avoid the landmines and pitfalls so the body can heal itself. And it doesn't matter what the situation is. And I know it seems super simple, like stupid simple, and it is. The challenge is keeping to things that are that simple and believing you'll get those results. And for those that are able to remove that monkey mind out of the equation and just focus on creating comfort, setting up the conditions that the body can heal itself, setting up the conditions that look like water, nutrition, breathing, mindset, supplementation, stretching, mobility, and finally exercise, that the body does what it wants to do. But what ends up happening is the brain kind of gets stuck in there where it's like, oh, I just got relief in my knee. I'm going to go test it. I was worried about it, and guess what? It got into pain. Well, if you just get it out of pain, and it's been in pain for a long period of time, you need to kind of practice a little self-restraint that you're not going to push the knee in a way that's going to make it worse. That's what we need to do. We need to create comfort, set up the conditions, and then give the body time to heal. Okay, Jimmy says, right, so simple but hard to do. You're so right. Thank you. It is, because it's a prerequisite. I know this. It's a prerequisite to have knee pain, to be a type A personality. You're a very motivated person. You like knocking stuff off your to-do list. You like making things happen. And that's what happens to a lot of people who aren't able to relax. It's too much in one direction. And that's not a bad trait or characteristic. We just need to realize that the body needs time to recover. We could push it as much as we want, as long as we train the body to recover after we've pushed it. There's no sense, there is no honor in kicking your ass to a point that you break your body down that you can't recover. Think about that. There is no honor in that. And it doesn't get you any further in your life with anything you do. You have to push. There's a time to push. There's a time to suck it up and go to work and be a parent or be a child to your parents, whoever it is. Like, we need to show up as human beings and do things and get things done. But many times the things that we're doing and we're pushing through the pain only end up to bite us in the butt down the road because we didn't really need to do it. And we made our situation worse. And now we're even more stuck and frustrated than we were before. So we have to, getting out of knee pain is really more about what's going on in your head than it is in your knee. The knee is just a symptom. Like, I'm speaking all this from experience. Like, I was in judo. All I wanted to do was throw people. When I finally went to the doctor after 4 knee dislocations, Dr. Ellis in Louisville, Kentucky, was like, Bill, you tore your ACL. I was like, okay. Well, what do we need to do? So we scheduled the surgery a month later. In my mind, in my 28-year-old mind at that time, I was like, oh, well, this is the whole problem. All the swelling, all the pain, all the discomfort, all the limping, all the back pain, everything my body was experiencing was a result of that ligament being torn in my left knee. And in my mind, I'm like, okay, we'll fix it. I'll be back on a judo mat. Doesn't quite work that way. Huge disconnect. Because a knee is mechanically sound doesn't mean it's going to be out of pain. That's what Jimmy was sharing a little bit ago. He had meniscus surgery. Just because you have meniscus surgery doesn't mean the knee is going to be out of pain. That's exactly what the PubMed and the New England Journal of Medicine link to the study down below in the description. It all makes sense. Just because you have the surgery doesn't mean you're going to be out of pain. Okay, let's see. What do we got here? We got another question. Bad cat. My 60-year-old wife had a meniscectomy in 2016. I waited in the car and got a call from the surgeon. She died on the operating table. Research shows the operation is worthless and long-term worse earlier. Total knee replacements, less success. Yeah, and sorry to hear about your wife. That sucks. But there's a real risk of having surgery, any kind of surgery, minor surgery, major surgery. There's a risk of opening up the outside of the body to the pathogens that exist in our world. This is not to poo-poo the medical model, because they play a valuable role. It's important, if something is broken or torn, that we have that option to draw on doctors to be able to help with the situation. I don't believe I could have gotten to the place where I am today without having the ACL repaired. The patella replacement in the ACL, which is they sliced a bit of my patella tendon, patella being kneecap tendon, put a pin in the tibia, the bone in my lower leg, put a pin in my femur, the bone in my upper leg, and recreated the ligament. I find it very valuable. However, once I got done with the surgery and the physical therapy, and I still had swelling and pain and discomfort in my knee, and it was difficulty bending my knee and getting my heel to my butt and walking without limping and having all sorts of achiness and tightness, and it was a nightmare with my knee. But going back to the docs and the PTs, it wasn't going to make the situation better. They didn't have the answer. That answer lies outside of the medical model. That's what I've spent the past 22, 23 years in what I've put together online. Okay, we got some more questions here. So let's see. So what is your time frame for this to begin to improve? It begins to improve the moment you get the pressure off of the nerves in the knee. The nerves in the knee, or the nerves in the body, fire at 286 miles per hour. So when you begin learning how to get the pressure off of the nerves in the knee, it's instant. Now, depending on your awareness, depending on what you're looking for, that will vary from person to person. People notice a change, but a lot of times they disregard it because it doesn't hurt. This is why it's a mindset thing. We need to stop focusing on the pain and begin focusing on something that's not pain, something other than pain. And something other than pain is going to be uncomfortable because now you are forced to feel what's going on in the knee, something other than pain. And I know it sounds like I'm doing like a word salad or semantics, but it's very important. We need to begin to develop your language on how your knee feels other than describing it as pain or tightness or achiness or discomfort or, we need to develop a different language for you where it feels, it feels like it relaxed. It feels like warmth or heat or cooling, or it's like it drained. You're looking for the different languaging for it. When you begin to develop the different languaging, as you begin to work with the intrinsic movement in the joint, you develop that language. You're going to come to the calls, the knee club calls, and you're going to be like, well, Bill, I'm not really sure how to put it into words. Something's different and I can't articulate it. Well, the pain moved. Why did it move from the front of my knee to the back of my knee? Why did it move from the inside of my knee to the outside of my knee? Why did it move down my shin? Why did it move up my hamstring? Why do I now feel all sorts of discomfort in my hips and lower back? So what ends up happening is you begin to, as we recede the pain, tension, and discomfort in your body, you gain more awareness in other areas of what's going on. That is key. That is your path out of pain. And it's not going to look like what you've been told to this point. It's not going to look like leg curls, leg raises, leg extensions, or calf raises. It's got to be different. It's got to be in a realm of possibility where your mind currently can't wrap its head around. Okay. I'm a person who wants it now. Name me a person who doesn't want it now. I mean, just to be real, D, like, who doesn't want relief now? If you're in pain right now, tell me one person. Name one person that would be like, oh, I'll hang out here in pain. I'll be okay. Nobody. Everybody wants relief now. As a nurse, I'm on my feet and a single parent, etc. I want my old body back, but I've struggled for 26 years with a knee issue. Well, sure. And we need to do it baby steps, one bite at a time. It's just, if you're a single parent, then you know how your child learned how to do things. When they learned how to begin to grab a pencil and write, they just didn't grab a pencil and begin writing. They had to develop the hand-eye coordination to grab the pencil. Then they had to develop the dexterity in their fingers to hold the pencil. Then they had to develop the strength to be able to put the pressure of that pencil down on a piece of paper. Then they had to begin to practice how to formulate letters. Then they had to practice how to put those letters into words. So this is, if you've been studying something, studying something, you've struggled for 26 years, your neurology is in a place that doesn't understand, that doesn't know how to not be in pain. That was very important. What I just said is huge. And this is why it's more of a focus on what's going on in your mind and your emotions than it is in your knee. We need to develop a different languaging. We need to develop a different way of looking at what's going on. You still look at knee pain as a struggle. Getting out of knee pain is not a struggle. Getting out of knee pain is the focus of looking at comfort that you've created in your knee, how it's shifted, and how we can create comfort again. It moves you down a different path. And it requires a little bit of patience and discipline to begin looking at things differently in your knee and in your body. So D, yeah, D. And, I'll say stuff like I tell members of Knee Club, which, by the way, if you want, we got that special going on this week, waiving the enrollment fee. You get 7 days to try it out, no cost or risk to you. You can try out Knee Club. And we have calls on Mondays and Thursdays. Mondays at 1:30 p.m. Eastern, Thursdays at 5 p.m. Eastern. But we get you in there and you begin getting results by getting the pressure off of the nerves. What I was telling Dee just a moment ago is members of Knee Club, they show up from all over the place. Like, we have members on, I think, 4 continents right now, different places. Members show up, they're asking questions, they're getting help and support. Some members need the cheerleader. Some members need me to be supportive and encouraging and there to give them hope. And then some members need me to be a drill instructor. Like, I need to kick their butt. Otherwise, they're not going to get the results. So we need to rein our minds in and our bodies in a way so you can continue getting results and focusing on the things that are important. Because what will happen is people with knee pain will want to tell you everything that's happened with their knee from the time that they fell off a swing when they were 2 up until yesterday. And then they'll want to talk about how their knee is always like this and the knee always hurts and there's always a problem. And what ends up happening is those stories of the past and of the future of what's going on with their knee keeps them from being present to what's going on right now with their knee, being focused and directed at what's going to create comfort right now, what's going to give you relief right now, what's an actionable step you can take right now. And this is why that when we go to either the past or the future, what's happening is we're dealing with trauma from the knee injury or trauma from something else that's happened in your life that keeps us distracted. It keeps us looking at, like, shiny objects, squirrel. And we run after that thing. But what happens is we avoid the very thing that's going to make the biggest difference for your knee right now. And that's what my job is in the context of Knee Club, is to rein you in, is to go, okay, D, stop focusing on that. You don't need to do that right now. You don't need to exercise. We need to get you comfortable. We need to get it functional so you have tools while you're a nurse, while you're at the hospital, and you have 30 seconds to pause and begin to stand a certain way that's going to begin to relieve the tension in your knees so it isn't so bad. Now, relieve it doesn't mean it's going to be completely gone. We're just giving you tools that we build upon. Things that you can do with your son or daughter, your child, that I do it with my daughter all the time. She's 7. So there's things that we work with together to help my body recover, because I'm no exception. I'm human. Life happens, stress happens, things happen. And just because my knee no longer hurts doesn't mean I don't have issues in other parts of my body. If this is making sense, give the video a thumbs up, like and subscribe to the channel, turn on notifications for future videos. Let's see. Share this with your friends, family, and loved ones that limp. Okay, Jimmy says, as Quint said, let's drink to our knee. What I do now, as silly as it sounds, is I've learned to nurture my knee, and as you say, stay in tune with your psychology each day. Took years to learn. Thank you. You're welcome, Jimmy. Let's see. Well worth it. Quality of life is at stake. Great program. Okay, so this is a point that Jimmy brings up. A lot of times the knee hurts, and then we get upset at the knee. Now I'm going to use it's going to be kind of a silly analogy, but it's very well applicable. You could think of the knee like a screaming child. And if you have a screaming child and you yell at a screaming child, the screaming child is not going to suddenly not scream. Or the situation is not going to get better just because you yelled at the child. Or the child, what we're trying to do is figure out what the child needs. Do you need a hug? Do you need food? Do you need water? Do you need a nap? Does the child need a diaper change? We don't know. But if we yell at the child, we're certainly not going to find an answer. And it's going to make the situation worse. A lot of times the knee is the same way. Like Dee was talking about, 26 years in pain. That's a long time for the knee to be in pain. That's a long time for a child to be screaming. Point of it is, once we figure out the right combination of what the knee needs, and it will change from day to day, it will change throughout the day. Because a child that has a dirty diaper in the morning and 15 minutes later, the child's crying again, if you go and change the diaper again, it doesn't mean the child's going to stop crying. The child may be hungry. It may be thirsty. And it's the same thing with your knee. And there's so many times that people who are stuck in pain for a long period of time, especially with their knees, they go back to this place and it's like, well, I did this exercise and it worked yesterday. Why isn't it working today? Well, because your knee is different than it was yesterday. This is why getting out of knee pain is not a knee thing. It's a mind and an emotional component that we need to take into consideration in the conversation. We have to focus on what the knee needs right now. And this is how, if we get stuck in the past or the future, we don't have a solution. We are stuck in the same place. You're on the hamster wheel. And that's why if you get exercises from the PT, exercises from the doctor, and you're doing those for months and months and months, and you're not getting results, well, it's because that's not what you need to do. Like many times, knee strengthening is the very last thing you need to do to get your knee out of pain. Because strengthening an already painful knee, a painful knee means there's a dysfunctional pattern that's going on in the knee. By strengthening a painful knee that has a dysfunctional pattern just makes a stronger dysfunctional pattern. You got to apply logic to this process, that we need to be adaptable and adjustable to understand what our body needs at any one point in time. And what that does is it facilitates the shift of what your neurology needs in order to continue to be comfortable. If this video is making sense, give it a thumbs up, like and subscribe to the channel, turn on notifications for future videos, share the video with your friends, the ones that limp. If you have questions, type those in the comments section. Well, the comments section, I'm not quite sure where it is on YouTube. We're on YouTube and Facebook. But if you do have questions, please enter those in. I'd be happy to answer those. Let me know what your situation is. You want to know more information, you can head on over to my website, thekneepainguru.com. All that information is in the description box below. I offer consultations to help you develop a strategy to get out of pain. And I also offer my group coaching program, Knee Club, which is the link on the screen right now, that we have a special going this week and this week only, where I'm waiving the enrollment fee, and then we're moving on into, you just go into a monthly membership. There's no obligation. It's month to month. You're into it as long or as short as you need to be. The idea is that you're getting results, and I'm helping you out the best I can, drawing on the past 2 decades of experience in getting my own knee out of pain and helping thousands of clients online. Okay, no questions are coming in. No comments are coming in. Jimmy, I thank you so much for your kind words. Appreciate that very much. D, you just let me know if you'd like some help and support. Anyone else, feel free to reach out. If you're watching the replay, please type in your comments there as well, as I read them and use them for future videos. We're going on 40 minutes. Okay, let's see. So head on over to, all the information's below. Join Knee Club. All of the information's at the checkout. I thank you all for being here. Thank you so much. It's an absolute honor to be able to serve and answer the questions. It's something that I've been given a gift for, to help people out of pain. If you'd like to help and support, I am here. Okay, this is Bill Paravano, the Knee Pain Guru, going to sign off for today. Have a wonderful day, and I will see you on the next one.